Good afternoon, everyone, and welcome. My name is Courtney Washington. I am the social media manager here at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. We hope everyone had a safe and fun Thanksgiving holiday with family and friends. So for today's Town Hall, our topic of discussion is diabetes. November is National Diabetes Awareness Month, a time where communities across the country come together to bring awareness about diabetes. So diabetes is a disease that occurs when your blood sugar is too high. So this disease affects about 37 million Americans, including both adults and youth. So today we have a panel of great experts who will be providing information and answering questions about diabetes. So if you have any questions, please make sure to leave them in the comments and we'll be sure to answer them during our discussion. All right, so on our panel today, we have Michelle Stancil. She's a certified diabetes care and education specialist in the Upstate. And we also have Minnie Cleveland. She's a certified diabetes care and education specialist in the Midlands. And also with us, we have Elise Lebel, board certified internal medicine physician at Prisma Health in the Midlands. All right, thank you ladies for joining us. All right, so let's get started with the first question. And I'm going to send this over to Miss Minnie. Minnie, what is the difference between type 1 diabetes, type 2 diabetes, and prediabetes?
Well, it's all about an organ called the pancreas. With type 1 diabetes, that means the pancreas is making little to no insulin at all. With type 2 diabetes, the pancreas is still working. And with prediabetes, with type 2 diabetes, the pancreas is still working. It's just not working at 100%. And with prediabetes, the pancreas is working some, but it's working enough to keep the blood sugars in a range so that it's not so high to be diagnosed with diabetes, but it's not working well enough to keep all those blood sugars in that normal range.
Thank you. Okay, so the next question is, can you share with us who's most at risk for diabetes?
The population that's at greatest risk, well, if you're 45 and older, if you have a family history, if you're overweight, if you have a sibling or parent with diabetes, if you're physically inactive, those are just a few of the risk factors for developing type 2 diabetes.
Awesome. Thank you so much for sharing that. So now we're going to head over to Miss Michelle. I'm going to put you up here. Michelle, what are some signs you might have with diabetes? And is there a screening that needs to be done?
Okay, yes. Signs include excessive thirst, increased urination, tired or no energy, slow healing, more infections, blurry vision, or there may be no symptoms at all. And yes, Courtney, there's a screening tool known as the diabetes risk test. It's available from the American Diabetes Association at diabetes.org. The test is 7 questions. It can be completed in less than a minute. If you score 5 or higher, you are at increased risk for type 2 diabetes. If you score 5 or higher, have a discussion with your provider because testing for diabetes may be indicated, and that can include fasting or random blood glucose levels and or an A1C. And who should be screened? All people 35 years and older. That is new in 2022. And screening should be earlier for those with risk factors or symptoms.
Thank you for providing those signs. So the next question is for you also. Can diabetes be reversed?
Okay. Minnie mentioned prediabetes. Prediabetes can be reversed. Today, when someone's diagnosed with diabetes, it cannot be reversed. There is a lot of discussion about diabetes remission. So that's a conversation to have with your provider. But today, diabetes cannot be reversed.
Thank you. So next I would like to ask you, so what types of diets is best for someone who has diabetes?
Great question. Everyone wants to know, what can I eat? There are many diets or meal plans that are available. The Mediterranean, the plant-based or vegetarian, low or very low carbohydrate. And there is the plate method. Using a 9-inch plate, fill half of it with non-starchy vegetables, a quarter with a protein source, another quarter of the plate with a starch source. This is a great place to start. But for individuals that want an individual meal plan, there is a service called Medical Nutrition Therapy. We refer to it as MNT. MNT involves the person with diabetes, their provider, and a registered dietitian who reviews lab work, medications, history, and incorporates food preferences into an individualized meal plan, like a nutrition prescription.
Thank you. So to piggyback on that question, Michelle, is the keto diet or fasting safe for someone with diabetes?
It may be. With those types of diets, keto and fasting, you definitely want to have a conversation with your provider and let them know that that is something that you want to try. There may be some additional lab work that is indicated, and there may be medication modifications that need to be made to do those diets safely. So definitely have that conversation with your provider.
Thank you so much for that. So now, Minnie, I'm going to go to you. So this question is, how is diabetes treated, and what can you do to make sure your blood sugar is controlled?
Okay, so diabetes is first and foremost, it's all about lifestyle changes. So it's about eating healthy, it's about physical activity. Someone may need an oral medication, a pill to take for their diabetes. Some may need insulin, some may need an injectable medication to help control their diabetes. But when someone is newly diagnosed with diabetes, making that lifestyle change, making a goal to get that physical activity in, making a goal to eat healthy, and along with the healthcare provider and prescribing the necessary medications would be the best treatments for getting the blood sugars under control. Because to keep those blood sugars under control, once the doc gives the medication or the healthcare provider provides the medication, and you have learned how to take that medicine, along with that medicine and eating healthy and getting the physical activity in will help control the blood sugars and keep them where they need to be.
Thank you. That makes perfect sense. So with the new technology that we have, how has technology improved the management of diabetes?
Wow, that's a good question. There are pumps out there, and there are CGMs or continuous glucose monitoring devices. There's the regular home monitor where you stick your finger. So with technology, back in the day when people were diagnosed with diabetes, they didn't know what their numbers were. They didn't know, how high or how low their blood sugars were. And when the pumps came around, the pumps allowed people to have an option of treating their diabetes. And with the pump, that eliminates all of the insulin injections. The pump delivers the insulin. And with the technology now, the CGMs are talking to the pumps, and they're letting the patients know that when their blood sugars are out of range, or when their blood sugars are going up, or when they're going down, they could just look at their CGM. If their blood sugars are high, they know they need to maybe incorporate some physical activity, or drink more water or liquid beverages without calories to get that blood sugar down. And if the CGM is in the direction where there is a low blood sugar, it lets people know that they need to go ahead and get a meal on board, or if it's really low, then they need to treat that low blood sugar according to what we know as the rule of 15. the technology just lets people know when they're in range, time in range, with the continuous glucose monitoring. So technology has come a long way. It's making it easier for people to manage their diabetes and know where they're going and know what their numbers are.
Thank you so much. So the next question is going to go to Dr. Lebel. I'm going to pop you up here. Hi, Dr. Lebel.
Good afternoon.
Thank you for joining. So your question is, do you find that patients are resistant to taking insulin when it could be beneficial, and why?
Well, I think a lot of people don't like needles. And I think a lot of people also have heard the urban myth that once you go on insulin, you're addicted to it. And so there's a lot of education that goes into play with insulin, and also sometimes education that the needles we use right now are so tiny. The biggest problem sometimes giving yourself an insulin injection is that you can't feel it if the needle comes out of your skin. And so sometimes people will not administer their insulin inside their system because they've been messing around with the injection device.
Thank you. All right, so we're going to head back over to Michelle. All right, Michelle. Is artificial sweetener safe for people with diabetes? And is sugar-free candy a better option than regular candy for someone with diabetes?
Well, it's recommended to reduce or avoid sugar-sweetened beverages. Minnie mentioned that. As people aim to reduce their intake of sugar-sweetened beverages, the use of alternatives like sugar substitutes with a focus on water is encouraged. Sugar substitutes have been approved by the FDA for consumption by the general public and people with diabetes. Sugar alcohols represent a separate category of sweeteners. Like sugar substitutes, they've been approved by the FDA for consumption by the general public and people with diabetes. So it boils down to balance and moderation with meal planning, as we've discussed previously.
Thank you. Dr. Lebel, we're going to ask you one of our previous questions about technology. So how has technology improved the management of diabetes?
Well, I agree with the previous speaker that the CGMs have just knocked the game out of the park. One, a lot of the people found it was very painful to monitor their blood sugar by multiple finger sticks, especially if you're up to 6 or 10 a day. And so that is removed by it. But it's also given us a huge safety factor. As much as I'm an adult internist, one of the things I love about the CGMs is that for people who have hypoglycemic unawareness, they don't know when their blood sugars are too low, the CGM can alert, whether it's their parent, their teacher, their loved one, so that the dangers some of these people face are much better controlled now. And then I also find a lot of people are much more responsive to diet. If I can check my sugar now, eat something, and then I can see where my sugar is in 30 minutes, 60 minutes, an hour, and just sort of watch the whole peak and flow, when before it would be like, well, do I want to put my finger again? So the real-time data has gotten a lot of my patients to modify their diets and to see how certain foods impact them personally versus just being told, well, oranges will tend to make your sugar go up more than strawberries will.
Thank you. So the next question for you is, does diabetes put you at risk for other conditions? And if so, why?
Diabetes, the elevated sugars are oxidants, and oxidants cause the equivalent of human rust, and human rust is plaque. And so diabetics, especially uncontrolled diabetics, are at increased risk of vascular disease, which can be cardiovascular disease or heart attacks, cerebrovascular disease or strokes, or peripheral vascular disease, which can lead to ischemia or poor blood flow in the limbs. In addition, certain diabetics are at risk of, for example, diabetic retinopathy. And diabetic retinopathy is worse if your sugars are more elevated and out of control. Though we've also found out recently that some of the complications like diabetic retinopathy definitely run in families. That, if your mom, dad, other relatives had diabetic retinopathy, then you're going to be at much higher risk, especially with uncontrolled sugars.
Thank you. So now what we're going to do is pop up Michelle and Minnie to answer this question here. So the question is, what is something about diabetes that most people do not know?
And I'll go ahead and start, Minnie, if that's okay. We mentioned earlier MNT, medical nutrition therapy provided by a dietitian. But what Minnie and I do, we have departments that are diabetes self-management, education, and support, DSMES. And we're an evidence-based service that's recommended for all people with diabetes to receive services from us. We're a multidisciplinary team. We're here to answer your questions. We're here to assist you with your technology. There's 4 critical times to consider a referral to DSMES when someone's newly diagnosed. That's a great time. There's a lot of questions. At that annual visit, if someone arrives at their annual visit and they have questions, maybe there's a medication they've seen on TV, or maybe they wonder if they're a candidate for technology, or maybe they're not meeting a treatment goal. That's a great time to refer for DSMES. If you have a change in condition, Dr. Lebel just mentioned some changes in conditions that can happen with uncontrolled diabetes, and as we get older. So if we've gone from a stage 2 to a stage 3 kidney disease, or we develop some neuropathies, that's a great time to consider a referral to DSMES. And then changes in transitions in care. So we service all individuals with diabetes, from children through adulthood. So whether they're transitioning from adolescence to adulthood, transitioning to parenthood, maybe some are transitioning to retirement, that's a great time to consider a referral to DSMES. So we wanted to bring that to your attention. Minnie, is there anything that you would like to add?
I think you about covered it, Michelle, but I would like to take this platform to just say, I know that a lot of people know how to treat a low blood sugar, but there's a universal sign or a universal treatment that is really nationwide. So when people visit a certified or recognized program, we teach that a low blood sugar for the majority of the population is any number less than 70. And anytime you get a number less than 70, you need to follow the rule of 15. And the rule of 15 is 15 grams of a fast-acting carbohydrate, wait 15 minutes, and recheck the blood sugar. So you're doing everything in increments of 15. We want people to know, no matter what state you visit, no matter where you land, the rule of 15 right as today is the same. And like if you were in a restaurant and somebody held their hands up to their throat, you know that's the universal sign of choking. We educators want you to know the universal treatment for low blood sugar is the rule of 15. And I just wanted to bring that to this platform.
Thank you so much. So now we're going to move to Dr. Elise.
I think the most important thing I want to tell my patients about diabetes is that there's hope. Because so many people, when they get the diagnosis, feel hopeless and out of control. And there's a very old study out of England called the Diabetes Control Trial Study. And what it showed us is if we can control your sugar, regardless of what it takes, we can put off the complications of diabetes 30 to 50 years. And if you look at the age a lot of folks are, 30 to 50 years is going to get you past whatever other medical problems are going to come to you. And that the important thing is control. And with control, there is hope.
Thank you. So how important is it to get treated for diabetes, Dr. Lebel?
It's very important to get both screened and treated. Most diabetes runs in families. So if you have a family history, getting screened once or twice a year, depending on what your previous numbers have been. because diabetes is one of the silent killers. You know, by the time most people get diagnosed with diabetes, they've been diabetic 3 to 5 years, and some damage is already being done. So, you know, routine follow-up with your doctor, your yearly labs, start giving us information about whether your sugars are elevated. But without knowing you have it, it's hard to treat it. And for a lot of folks at a certain point in time, diet helps, but is not enough.
Thank you. So should people monitor themselves closely when they have like a family history of diabetes?
I think at least yearly or biannual visits to your doctor would make sense. At least once a year, and if some of your sugars have been elevated, twice a year. And then definitely if you have unexpected weight loss, changes in your vision, these are sort of signs that your sugar may have been climbing up and are that you just don't know you have diabetes yet.
Gotcha. So since we're on the topic of family history, does genetics play a part in people being diagnosed for diabetes?
Type 2 diabetes is definitely genetic. If one parent has diabetes, type 2, you have a 50% chance. If both parents, it's close to 100% chance. And then even type 1 diabetes, we found more recently, has a genetic component to it as well. So it doesn't mean that you will get diabetes, but definitely, you know, with family members, your chances are much higher. And with increased weight, you're going to be more likely to manifest diabetes sooner, as we're finding with a lot of our teenage and pediatric population.
Thank you so much for sharing that. Do we have any additional questions or comments? All right. Well, what I want to do now is go around and have final thoughts from everyone on the panel. So Dr. Lebel, since I have you up, do you want to have any final thoughts for diabetes?
I think being proactive, knowing how to treat a low sugar, as some of the other panelists have discussed, is important. And also just knowing there's so many new medications out there. Some of my patients have feared a diabetes diagnosis because they would have to go on insulin. But with all these new medications we have, many, many more of my patients may not go on insulin. You know, it's been a lot longer since we've had insulin starts, especially for the type 2 diabetes, with aggressive management early of their type 2.
Thank you. So now we're going to move on to Minnie for your final thoughts.
I would just like to say that diabetes is, you know, if you're diagnosed with diabetes, as Dr. Lebel said, it's not the end. We are here to help. We know many people who have been diagnosed with diabetes, type 1 diabetes, early on, you know, with it when they were very young children, and those young children are now adults. And some of those adults, they don't have any complications associated with their diabetes because they have controlled it from the time they were diagnosed with it up until now. So we're here for you. We have registered dietitians, as Michelle was saying. We have other diabetes educators, certified diabetes educators that are here for you. We can be part of your team if you allow us to come in and help you manage your diabetes.
Thank you. All right, and now I'm going to move over to Michelle for your final thoughts.
All right, well, thank you. I definitely agree with Dr. Lebel and Minnie. We have so many tools in our toolbox today to manage diabetes, and we can manage diabetes so much better. And so there is a lot of hope. So we are here to help you on your journey. New things are coming out all the time. We stay on top of all the new advances with both medications and technologies. So we look forward to serving you and your family, and thank you for this discussion today.
Well, thank you, ladies, for joining us today and providing this information to the people in our community. Thank you to everyone online for joining as well on Facebook. If you have any questions after this live, please make sure to add them in the comments and we will answer the questions as soon as possible. So if you have any additional questions or more information about diabetes, or maybe schedule an appointment with our providers, please make sure to visit our website. Thank you guys for tuning in, and we hope to see you for our next Facebook Live Town Hall. Have a great day.